Good afternoon and hello. My name is Renee D. Waring and I am the founder of Uniquely and Wonderfully Made Ministries. Welcome to the second installment of my series entitled, quote, The Stigma of Mental Illness, Part 2 R period WARRING. Please be aware of the fact that much of what I say are quotes from the online article, quote, Mental Health, Overcoming the Stigma of Mental Illness, unquote, by the Mayo Clinic staff, written on May 24, 2017. Last week, we learned from the article entitled, quote, The Stigma of Mental Illness is Making Us Sicker by Michael Friedman, PhD. People who have mental illness experience social distancing when they are isolated from the rest of society. Currently, mental health is costing us $2.5 trillion worldwide. In 2030, the cost is projected to be $6 trillion. The negative attitudes and negative stereotypes marginalize people who have mental illness. Many healthcare providers and mental health professionals believe the stereotypes also. As a result of stigma, people with mental illness have poor mental and physical health, and most are destined to die prematurely. Stigma complicates the care and resources available to people with mental illness. It has been proven that stigma causes a lower prioritization of public resources and therefore a poor quality of care for the people. Today's presentation article entitled, quote, Mental Health, Overcoming the Stigma of Mental Illness states a definition of stigma, and I will quote, Stigma is when someone views you in a negative way because you have a distinguishing characteristic or a personal trait that is thought to be or actually is disadvantage, negative stereotype, end quote. The harmful effects of stigma are the following. Number one, a reluctance on the part of people who have mental illness to seek treatment. Number two, a lack of understanding by family, friends, co-workers, and others. Number three, fewer opportunities for work, school, or social activities, or trouble finding housing. Number four, bullying, physical violence, or harassment. Number five, health insurance that does not adequately cover people's mental illness treatment. And number six, the belief that you will never succeed at certain challenges or that you cannot improve your situation. Next, I will discuss how to cope with stigma. First, don't get treatment. Don't let fear of being labeled as someone who has mental illness prevent you from seeking help. Second, get help at school. If you have a child or young adult who has a mental illness that affects their learning, get help from them. First, find out what plans and programs might help. Students who have mental illness cannot be discriminated against. The law states that students in primary, secondary schools, as well as those in all levels of college, are entitled to get help. Third, speak out against stigma. Express your opinions at events, in letters to the editor, or on the internet. The general public's judgment about people who have mental illness stems from a lack of understanding. Learn to accept your condition and recognize what you need to do to treat it. Seek support and help to educate other people, which can make a big difference in our society. Thank you for listening to my presentation today. My next airing will be either on Thursday, November 1st or Friday, November the 2nd. Tune in next week and ask someone to view my presentation with you. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Waring, and I am the Warrior Warring.